Malayali Association of Tampa, MAT. Today we are here to interview Dr. Lindsay John, infectious disease specialist, about the new coronavirus. Dr. John is board certified in infectious disease and internal medicine. He practices in Winter Haven and is affiliated with 3 other hospitals. Dr. Lindsay John is here with us, and let's welcome Dr. Lindsay John. Our community has a lot of questions lingering in the back of their mind. One of them is about social distancing. So our community, how are we going to practice social distancing? What are your guidelines to our community members regarding the social distancing?
Yes, so this is a term that we are going to hear more and more commonly. Social distancing refers to the safe distance that you have to maintain between people in order to prevent the spread of the virus. For this, we need to understand the basic of how the virus spread. Main mode of spread is through person-to-person spread by directly affecting the respiratory secretions that land in the surfaces around the person when they are infected and they cough, they sneeze, or even when they talk. Usually these respiratory secretions, which we call droplets, do not linger in the air, but rather they settle down in surfaces within a distance of about 1 meter, approximately 6 feet. So people get infected either by coming directly in contact with the secretions or by touching contaminated surfaces around them within that distance. So social distancing refers to that safe distance, which is approximately 1 meter or 6 feet.
If we happen to get infected, at what stage we need to go to the clinic and undergo a testing?
So to answer that, first we have to recognize the signs and symptoms of this illness. The COVID-19 usually manifests as number 1, fever, which is the most common symptom found in 99% of the patients. Other than that, you usually have a dry cough, sometimes you have a sore throat, and sometimes you can develop even difficulty breathing. So knowing that most patients are usually asymptomatic. 80% of the people do not have any symptoms or have very mild symptoms where it's not even bothersome. The rest 20% are the ones who develop symptoms sick enough that they need to seek medical attention. Most commonly it is shortness of breath, where the fever gets worse, the patient becomes confused, sometimes the oxygen level drops, they become cyanotic, which means bluish discoloration of the face and the lips, and these are warning and danger signs that you have to seek medical help immediately. So this is the time when you call your provider and you know that you have to seek help. Coming to testing, now that's a very important point. As you know, the symptoms resemble any other viral illness. You may be having the common cold or the flu. So if you're sick and you do not have much problem, you do not really need to go to get tested, especially in the setting that we are limited right now in our capacity to test. So if you want to get tested, I would advise you call your doctor's office ahead of time before you go there or before you go to the emergency room. Because without calling ahead, you do not know if they have a test available, and also if you really do not have the COVID-19, your chances are higher of going to a public place like a doctor's office or an emergency room to have it tested. And I would reserve testing to the advice of your physician, or if you see one of the danger signs and you know that you have to seek medical help, then you go to the hospital and they will test appropriately.
നമ്മുടെ വീട്ടിലൊരാൾക്ക് അസുഖം വന്നു എന്നിരിക്കട്ടെ, നമ്മൾ എന്തെല്ലാം പ്രിക്കോഷൻസ് ആണ് എടുക്കേണ്ടത്? അതുപോലെ തന്നെ രോഗിയെ എങ്ങനെയാണ് നമ്മൾ ശുശ്രൂഷിക്കേണ്ടത്?
Okay, yes, that's a very important point. What to do when you are sick? If you are not seriously ill, number 1 advice is stay at home. Do not travel, do not go outside unless to seek medical help. Number 2, avoid public areas. Do not go to school, do not go to your workplace, do not go to places of worship or any other public place unnecessarily. The most important thing is you are trying to prevent the spread of this infection to other people around you, both in the community, at your workplace, also in your homes. So at home, what can you do? Number 1, try and avoid contact with other household members as much as possible. If you can stay in a separate room and use a separate bathroom, that's a good thing. Avoid sharing your personal items or in the household with other people during this time. Number 3, avoid and limit your contact with household pets even. because even though the CDC says that it is not transmitted through pets, you can get various other illnesses from the pets when they are sick, which you don't recognize. And another most important thing is the use of a face mask. The CDC recommends when you are sick, that's the time to wear a face mask, because that's how you prevent the spread of your contaminated droplets to other people in your household. Also, what to do if a person is sick at home. That person needs to wear a mask. If they have difficulty breathing or wearing the mask, sometimes they are at high risk of contaminating you or the surfaces around them because they are unable to wear the mask. So it comes back to the basics, two very important steps that we always forget. Number one, wash your hands as much as possible during that time. The CDC recommendation is washing with soap and water for at least 20 seconds. You can also use an alcohol-based hand sanitizer. They recommend at least a 60% alcohol. The other thing to do is during this time you should avoid, for all reasons, touching your nose, your mouth or your face, because that's how you get it after touching infected surfaces. So be conscious about that. And the next point is also, when you have a family member who's sick, you need to be able to recognize the danger symptoms, like I said. So when you have a problem, you be ready to seek medical attention at the earliest sign that the patient is getting worse.
Kids and young adults and teenagers, they have a tendency to go out even during the national emergency. So what are your advices to them?
Yes, so to know the seriousness and the consequences of this action, we need to know about the disease and how dangerous it is and what is its why it is so important. Number one, when we talk about a disease, we mentioned the deadliness in terms of case fatality rate. For the seasonal influenza, usually the mortality rate is about 0.1%. From what we know from the studies, from what WHO has shown and CDC has shown, there is a mortality rate for the COVID-19 of at least more than 2%. So that itself is 20 times more likely to kill. And who are the people that we know are most affected? Like I mentioned, it's usually people above 70 years of age. The risk increases to about 10% when you're more than 70 years of age. It increases to close to 14% when you're more than 80 years of age. So the elderly people at home are the ones most at risk, and also people with chronic medical conditions. So knowing this, when you talk about teenagers and young kids going out and exposing themselves in the public unnecessarily, they do not know if they have the infection or not, because most young people will be in the asymptomatic group, where they don't even know they have the virus. They bring it home and they will be shedding it to their loved ones. We all have parents and grandparents of that age who are at very high risk of this. So that's the importance of them not avoiding, following the advice and avoiding the public.
നമ്മുടെ വീടുകളിൽ ഗ്രാൻഡ് പാരൻസ് ആണ് കുഞ്ഞുകുട്ടികളെ ടേക്ക് കെയർ ചെയ്യുന്നത്. സോ അവരും ലൈക്ക് ദേ ആർ ദ ഗ്രേറ്റർ റിസ്ക്. സോ അവർക്ക് എന്തെങ്കിലും അഡ്വൈസ് ഡോക്ടർക്ക് പറയാനുണ്ടോ ആ ഒരു babysitting nature?
Yes, that's a very good advice, because at this stage they are the most vulnerable people. So it is very important to limit all sorts of contact for them with anybody in the household or in the public who may potentially have the virus. Now we hear about widespread cases and epicenters in different parts. We don't know if it's here in Florida. The situation is already different. It's out in the community. We have not had enough testing to know how many people are there. So right now, that's why there is national travel bans, there is ban against national gatherings, going out in public places, and social distancing is advised. So there is always that risk. So avoid visitors to home, avoid other people in contact with older folks and those who are sick as much as possible. That's the best advice that we can give and follow at home also.
Asthma, diabetic and other health conditions, അങ്ങനെയുള്ള വിഭാഗത്തിൽപ്പെട്ട ആളുകളോട് ഡോക്ടർക്ക് എന്താ പറയാനുള്ളത്?
Specifically with the COVID-19 illness, we have not particularly seen an increased problem with asthmatics per se. But overall, we've known that the patients who get sick and who have high risk of mortality are those who are immunosuppressed. Generally speaking, we say people with chronic lung conditions, mostly COPD and others, also with diabetes and chronic heart disease. But there is no specific data to suggest that asthmatics are at higher risk. So the advice is to continue to follow the same precautions that you usually do when you have any other viral illness or outbreak. If you get short of breath, make sure you stay on your inhalers, make sure you stay on your controlled medications, and always call your doctor to see if you need steroids or antibiotics or other help.
Doctor, we owe you so much for all this valuable information. So finally, do you have anything else to talk to our community? Any new advices for our community?
Yes. So what I would like to say in conclusion is that we are right now in a truly global epidemic. The COVID-19 has spread throughout the world. We have approximately 140,000 cases confirmed and more than 5,000 deaths. The epicenter that started in China has now moved across the world. It has reached Europe, where there are many cities. Now we are seeing epicenters of cluster cases in the United States, in many different parts. It has now spread to affect every single state in the US. So far, except it has spread to approximately 49 states out of 50 states. It has already reached Florida. We have confirmed cases here. It has reached. We are particularly at risk because we import more travelers than any other state for two reasons: because of our popular tourist destinations, also because there's a lot of cruises going out from here. So we are at risk. To our community, particularly as Indians, we all have many people who are in the healthcare profession, either as doctors, nurses, respiratory therapists, physical therapists, pharmacists, and we are intricately involved and associated with people in the healthcare field, and we are going to be the front line facing these people and exposing ourselves. So just like the CDC says, things are going to get worse. What they mean is that we do not have the capacity to know how many people are infected. As more testing comes out, we are going to find more and more cases. It's going to be all around us. People are going to panic. It's going to be a scary situation. But what I want to say is that we have to be calm. All of us are going to be exposed, and probably as healthcare professionals, we are the ones to avoid this panic, to follow the guidelines, and together we can beat this epidemic and the spread. So let us follow the advice of the experts. I would highly recommend go to the CDC website, cdc.gov. It is very comprehensive, gives us information on each and everything, what to do at home, how to take care of the sick, when to wear a mask, when to go to seek help, when to get tested. So these are all important things, and let's follow the advice that they give us. Stay away from public places. Come home if you are sick. Wash your hands. Use hand sanitizer. Care for those who are sick around you. And together with all these measures, I'm sure that we can beat this epidemic, and we can do this all together. And I would like to thank at this time the Malayali Association of Tampa and Matt for giving me this opportunity to present this information, which I think should be helpful to our community and help us to beat this together.
Thank you, Dr. John, and together we will fight this battle.